Welcome to the third installment of Better Together, Food System Best Practices for Navigating COVID-19. We've really enjoyed the discussion series so far and are grateful and excited to keep that going. I know that many of you either already know ReFed or have gotten to know us through the previous two discussions, but for anyone who's new on the call today, just wanted to provide a quick 30-second intro to us as an organization. We work primarily to motivate and mobilize our stakeholder network throughout the entire food system to be advancing solutions to reducing food waste. And with that holistic view of the food system that we have, there are three primary areas that we focus our work. One is around being a source for data, insights, and best practices. Another is around being a catalyst of promoting solutions-driven action highlighted through that data. And then finally, acting as a connector to help facilitate collaborations and partnerships between stakeholders, again, throughout the supply chain. So part of the purpose of this discussion series is to continue to play that role as we're all facing some unprecedented time during COVID-19 and trying to keep a level of connectivity with our various stakeholders and partners throughout the supply chain. So we hope to continue doing that through this discussion series going forward. We are continuing, as always, to learn and adapt as this situation goes on with COVID-19, and I hope personally all of you are continuing to adapt as well, and then professionally I know we're continuing to learn and improve our own processes. Today we're going to be focusing on the topic of safe operations and food handling, and I think it probably goes without saying that coronavirus is necessitating new ways of working to keep both our employees and consumers safe within the food system. So anything from social distancing and A/B teaming models to hand washing and other food safety measures, there's an entirely new set of operational standards that we're having to implement, in many cases on top of existing standards. And on top of that, food safety obviously must be maintained and in many cases improved through those processes. So today we have a panel of food safety experts and frontline workers that are going to be discussing the best ways that we can be safely running food organizations during these times. Before we dive in, as has become tradition on these calls, we'd love to get a view of who is on the call, especially for our speakers, so they can kind of understand who they're talking to. So Nathan, if you can bring up our poll, I would once again ask people to take just about 3 seconds to identify the sector that best describes your organization. And that should have just popped up on your screen if you see a little window. Great. Thank you so much, everyone. That is helpful as always. Well, without further ado, we are going to go ahead and introduce our 4 panelists for today. And as always, our goal for these discussions is really to be sharing and amplifying best practices to help everyone. So as we have the discussion and the Q&A and opportunities to share later, just ask that that remain our focus, participants and speakers alike. So with that, we are going to start from hearing from Dr. Ben Chapman. He is a professor and food safety extension specialist at North Carolina State University. With the goal of less foodborne illness, his group designs, implements, and evaluates food safety strategies, messages, and media from farm to fork. Ben also co-hosts a bi-weekly podcast called Food Safety Talks. That may be of interest to people following up from this webinar. Next, we're going to hear from Tracy Chang, chef and owner at Tagu. She is an alum of the James Beard Foundation Boot Camp for Policy and Change program and also a 2020 James Beard Best Chef Northeast semifinalist. Recently, she's helped launch the Off Their Plate initiative in Boston, which is feeding healthcare workers in the emergency departments dealing with COVID-19, while also providing economic relief to restaurant employees. Next, we're going to hear from Sue-Lynn Terhell, who's the Operations and Strategy Manager at Replate. Sue-Lynn's career has spanned environmental science, geographic information systems, and technology. And as Operation Manager at Replate, she combines her analytical and environmental interests to redistribute surplus food throughout the U.S. And then last but certainly not least, we have Kevin Smith, Senior Advisor at the Center for Food Safety and Applied Nutrition at the U.S. Food and Drug Administration. Kevin helps advise FDA's leadership on strategic initiatives and program development related to FDA's food safety mission. In addition to leading FDA's efforts on food waste and recovery, Kevin also co-leads the implementation of regulations for sanitary transportation of human and animal food. So we have a very, very exciting panel today. Really glad to have their expertise on the line. I'm going to get us started just by asking 2 questions to kind of guide their opening remarks over the next few minutes, and then we'll go ahead and go in that order. So if you guys could speak to what new employee, customer, and food safety challenges you're seeing along the food supply chain as a result of COVID-19, as well as what scalable solutions or innovations you and others are using to keep employees and consumers safe. And one final reminder for our participants that the chat bar is now open, so at any point, please send your questions or best practices to Angel. And with that, Ben, I will hand it over to you.
Great, thanks a lot, Jackie. So as Jackie mentioned, my name is Ben Chapman. I'm a professor at NC State University in Raleigh, North Carolina. Over the last 6 or 8 weeks, I've really been focused on supporting various stakeholders in the food area. What I normally do, not around COVID-19, is focus on food safety, really from farm to fork, from production agriculture to farmers markets to restaurants and consumer homes, with emergency food distribution channels in the middle of that. And as Jackie sort of posed this question about big challenges for all of those areas, really has been, I guess, wrapped up in what I can sort of say is SARS-CoV-2 and COVID-19 a food safety issue. And early on in this pandemic, a lot of my questions were really related to what do we know, and does it look like there's a foodborne illness connection? And so what I'm normally working on are things like E. coli and Salmonella and norovirus, and where many questions have really lied since then, is the answer to that question is really that the risk factors for getting sick are really being around people, whether it's symptomatic or asymptomatic individuals, where if we look at our food supply chain, there are a lot of situations that put consumers as well as individuals within the chain close to others, but food or food packaging really has not been shown. We don't have any evidence of clusters or any examples of people getting sick through those means. And so a lot of the biggest challenge is really trying to explain the epidemiology, sort of the study of disease, as well as the biology of the virus as to why that's the case, and getting into some of the nuance of questions related to how long does the virus survive or remain viable on surfaces, to how does it get transferred within a restaurant setting, between employees, and from employees to consumers, and what does that pathway look like? And so those have really been a lot of the challenges. It's really the helping understand the biology and the science of the virus itself. Some of the solutions, I guess, to highlight, I'll throw a couple of links here into the chat box. One is my group at NC State has really led a national approach through academics at various different universities to sort of collate best practices for anything around food, from running a U-pick farm to cloth face coverings for food employees in restaurants. And so we have about 60 different resources that are available at that link. And so a lot of our I guess our solutions have been trying to stay up to date with what we see in the science and in the literature, and then digesting that down into easily communicated steps, and then putting that out there. The other challenge that I'll highlight really quickly is, as the country and different jurisdictions through the country look at steps to reopening, or whatever the terminology that many are using, but really relaxing social distancing and physical distancing, whatever that timeline is. A lot of the challenging questions that we've been receiving is what do we do? What are the specifics of how should the food industry manage this? What are the risks, and how do we protect our employees as well as our patrons? And so I was part of a task force over the last couple of weeks, as part of the National Restaurant Association. And I put another link into the chat box from a document that resulted from that task force, from the Restaurant Association on reopening guidance. And so I think there are some specific steps in that document that help answer some of those questions. But I guess to sum it up, Jackie, to your question, the uncertainty and evolving nature of the biology and the epidemiology of this virus are really the biggest challenges that my group is facing every day, and then trying to provide actionable and practical steps for the food supply chain to actually manage it.
That's great, Ben. Thank you so much for kicking us off. Tracy, let's go ahead and go to you.
All right, thank you. Great, so I'm the chef owner of Paibu Restaurant in Cambridge, Massachusetts, and I don't know if people can see me. They can't, right? So I'm sitting in the restaurant right now, and
we can see you, Tracy, so we can see your backdrop.
Oh, great! Everyone can see the restaurant. Okay, because I just see, I see our portraits here. So around May 15th was our last service for dine-in at our restaurant. It was a Sunday, happened to be the end of that payroll cycle, and we anticipated the government mandate coming through to shut down all dine-in in our state, which came, I think, 1 or 2 days afterwards. So just the week before, one of my restaurant regulars, Natalie Guo, had reached out to me about an idea to connect donors with restaurants with healthcare centers. And the idea was to provide economic relief to the most vulnerable employees of restaurants that were about to shut down, and to provide meals to healthcare workers dealing with COVID in emergency departments throughout Boston, throughout New York City, San Francisco, et cetera. And so within a few days, we put together a pilot and ran 90 meals to Brigham and Women in Boston. And, on our end, we said, hey, we can definitely, make the food. Like, that's no problem. We are a restaurant usually, and that's something that we are quite familiar with. But as I was doing this pilot, and I actually, drove the food with Natalie to do the drop-off, I realized, if we're trying to do this, at scale, we want to do it in the most responsible way possible, we're really going to need to put together solid SOPs, because there's not enough information out there about COVID as it pertains to food safety. There wasn't a lot of guidance from both our local and national legislation. And so, we started looking to the scientists, the doctors. We started listening to what was going on in China and Italy, other countries that had already been hit harder with COVID. And essentially what we did within a few days was we launched an initiative called Off Their Plate. And we grew it to 9 cities nationwide. And now today, about 1 month in, a month and a week and some change, we're in these 9 cities and have over $3 million of funding. We have, $10 buys 1 meal, and that entire $10 goes to the restaurants. And our restaurant partners, they commit to a 40% to 50% contribution directly to wages. The rest of it essentially is covering the food, utilities, insurances, et cetera. And these SOPs that we've established, are a complete work in progress. So we do have professionals that have reviewed the SOPs, and they include, details in mask wearing, as Ben had mentioned, to how to properly hand wash, linking to videos and infographics in various languages. Video-wise, there's particularly one that I appreciate a lot. It's with black paint, and you can see which areas of your hand are not being washed. So that's one that I can recommend for sure. Things we've learned about mask wearing in talking to some experts here at MIT. We've learned that in mask wearing, when just having a face covering is not sufficient as wearing a mask that allows for sideways airflow versus downwards airflow. So for instance, I've seen people walking on the street with bandanas, and if they're going to be preparing foods safely, then a bandana or a handkerchief is really not recommended, because the airflow actually goes downward into the food that you're preparing. So that's added risk for spreading COVID. What else? Also, lessons learned that we have heard from our friends at MIT, actually some regulars that come to my restaurant just down the street, is respiratory droplets and sneezing. I think a lot of the information early on out there said that spreads 6 feet, maybe 10 feet, maybe 12 feet. And so we should maintain, social distances of 6 feet, or if you sneeze, make sure you clean up a radius around you of like 6 to 10 feet. Those droplets can actually spread up to 23 feet. So that's really good to know. And, so if anyone happens to sneeze, or cough, even with a mask on, it's recommended. We have some standard procedures that we recommend for, disinfecting a larger kind of radius around that person. We're happy to, take these SOPs and share them. We've learned a lot from just kind of operating and being like in this as someone who has been preparing the food, making the deliveries. I understand, from start to finish, opening the restaurant, closing the restaurant, like dropping food off, delivering it, and having other people receive it. And so we make very specific guidelines tailored to that. We're completely, open to feedback. It's, again, a document that is a work in progress. And I hope that, this can be a tool and a resource for other folks that are doing food service out there. It does present challenges for reopening for dining in, with HVAC, airflow. If you're listening to what other countries are doing in terms of like plastic partitioning, these are all things that we're looking into for evolving our resources for folks, so we're not just providing SOPs for say catering, right, or takeout. I do believe that the information is not always the best received as just like a document to read. So we are working on providing instructional videos, as well as doing this in not just English, but Spanish, Mandarin, Portuguese, and some other languages.
Great, thank you, Tracy. And now Sue Lynn.
Hi, I'm Sue Lynn. I'm with Replate, and I hope you don't hear the airplane above me too loud. I'm sorry if you do. But at Replate, what we typically do is pick up surplus food from sources like office spaces, caterers, events, and this is usually all prepared food, and we bring this food to nonprofits nearby. And there was a huge shift in what we experienced when COVID hit, like many other types of organizations, but we no longer had nonprofit recipients who could remain open and have groups of people coming to their nonprofit for what services they provide and to receive meals that we were able to give these nonprofits. So we had to think about how to adjust and shift in a time like COVID. And when addressing food insecurity with the nonprofits we work with, what we are doing is looking to shift to a home delivery model so people can still receive food. They don't have to go out and congregate at the nonprofit they do this at, and doing it in a way that is contactless, similar to like DoorDash and Postmates. They are all doing contactless deliveries, and also making sure that our rescuers have the correct gear that they need to do this in a way that is going to be safe for everyone. And like what's been brought up, there is no clear and concise guidelines coming from, you know, a source telling us what this looks like, but what we are asking is masks and hand sanitizer and doing contactless deliveries to still be able to provide food to our nonprofit recipients at a time like this when we can't actually congregate in large groups.
Thank you, Sue-Lynn. And to close us out with the opening comments, Kevin, we will turn it over to you.
Good afternoon, folks. Thanks for having me, ReFed. You know, this is obviously a difficult time, and one of the reasons I feel fortunate to be involved in public health and food safety for so long is I get to see what the industries, whether it's food service, institutional food service, retail, the amazing food recovery and food rescue space, and of course the charitable organizations that are addressing food insecurity, they all have always shown so much care for their customers, for their clients, for their patrons, for the people that they're serving. And I know that's going to continue in this case, but now it's this added challenge of having to also care for each other to prevent the spread of a virus that transmits from person to person. So keeping the attention on necessarily on keeping the food safe, while also figuring out how to do this and prevent the spread of COVID from person to person it's just such a huge challenge. And I know that people are going to be up to it because everyone cares so much about taking care of the people they're serving. But there's no doubt that creating a culture of food safety, which we've been working towards, and I think we're successful nationally. Everyone is realizing that food safety is very important. In all that time, it's one of the biggest challenges has always been how employee health, the health status of people, either employees or volunteers, how that can impact food safety. Well, that's already a very difficult challenge for training around, for making people understand where the hazards are and how their daily activities impact that. Well, now you have to also layer on a new set of, I call them requirements, but a new set of lessons that have to be learned by all these people about how to operate your business in a way that does not put people at risk for COVID-19. So FDA and other federal partners we're doing our best to try to get information out there for folks. If you haven't already done so, I encourage you to go to the CDC's website. Has tons of information about specific guidance for controlling spread of the virus. The FDA website has a lot of resources that are more tailored. Well, of course, we're tailored on the drug and device side and all the vaccines and all that, of course. But on the food side, if you go to our food safety site, food safety and COVID site, you'll find a lot of resources, things like how best practices for the retail food service sector. That's attempting to put it in terms that both the operators and owners of establishments can digest and understand, but also help, hopefully, in a way that makes it easy to explain to their employees and their volunteers, We hope that's helpful. Also in more specific guidance about the use of masks and face coverings, what to do if an employee or a volunteer or a person in a food operation tests positive for COVID. You can find information like that there. Not so much in an SOP format. That's why I'm so thrilled to hear that there's so many working on how-to tools, SOPs that can be followed. But I encourage you to take advantage of the resources that FDA makes available for just some basic information about how you can both limit the spread of SARS-CoV-2 as well as how to keep food safe and reinforcing the same food safety messages that we've done so much work to try to do. Thank you very much for all you do.
And thank you, Kevin, and thanks to all our panelists. It's great to both hear what you're doing and then also just hear of so many additional resources that people can be looking to after the call today. We do have some questions coming in, so we're going to shift that way, but just one more reminder to please send any questions through chat to Angel. And then also if there are any other best practices that you're seeing or experiencing yourselves that you would like to share with the group, you can also send that to Angel and we will cover those. But let's start with a couple of questions. And Tracy, I'm actually going to go to you first. There's a couple, I think, quick ones here. One is around just how people can access the content that you're creating through your SOPs after this call, and if that's something that we can help distribute, that would be great to hear. And then also following up on those SOPs, what type of guidance are you giving on how close people are working together, just knowing that kitchens are often small and space is limited?
Yep. Yeah, so in terms of sharing our documents and resources, I think I replied privately to Angel, it seems. Anyway, so I provided the two links. So one link for the Respiratory Droplets article, and then the other link for the proper hand washing video of showing the black ink. And yes, we are working to make our SOPs public, so I'll let you know if that's just me sending it to you via email, or if it's, people can visit our offtheirplate.org website or something. We're still figuring that out. And we're also actually collaborating with a couple of folks to, like I said, make that document even more comprehensive with infographics, video content, language translation, etc. So that will be a little bit longer, but the English version will be made available, within hours. Great. Did I miss anything?
No, I think that's, and then the question around recommendations for how close people are working together in small kitchens.
Yeah, so, we're fortunate to have a lot of space here, and also we don't have more than 4 employees in the kitchen at a time. And we're also working pretty efficiently out of our ovens and not really even using our flat tops that much. So if there's anyone that has specific questions about how to kind of streamline the processes of, cooking efficiently and effectively for hundreds, we've done over 1,000 meals out in one day, and I'm happy to share the recipes that we have to cook out of a combi oven, etc. In terms of how to, maintain safe distancing, clean workstations, etc. Because we're limiting the number of people and we have the amount of space, we set up workstations to be more than 6 feet apart from each other. If anyone's passing each other in a corridor, they wouldn't pass each other in a corridor. There's only, kind of like a one-way street, one person, one vehicle at a time. So no one should be kind of brushing up against each other. And, our entire dining room is empty too. So if there's any reason that we need to, kind of move a project out here, whether that's packing or, labeling or, receiving goods and kind of, taking care of those goods, and we can also do that in the dining room.
Great. I'll actually just take one question that was shared. People are asking if the resources in the chat will be made available. And yes, when we send out a follow-up email to this, we will make sure to include the links that are in the chat, just to answer that one quickly. Sue Lynn, a couple questions for you, and Tracy, you may be able to add on here as well. But there's questions around delivery models. One around what type of processes are you putting in place for contactless delivery and payment? And then also, what type of liabilities are you facing with now delivering to individuals instead of organizations?
Yes, so for our contactless deliveries, we deliver food for free to our recipients, so we don't have to deal with the payment side of things. We are delivering food that is being fully prepared, packaged, and wrapped in a kitchen. So our food rescuers have like even less opportunity to really interact with the food itself. And we have everyone's numbers on file, so it's usually knocking on the door and leaving the package and walking away. And if you see that someone's opening the door and taking the food, you're set, but we have people's contact numbers to be able to text and call them if it seems like no one is coming out to receive the food. So we have a lot of ways of communicating without actually having to do it face to face. In regards to liabilities, that's a very interesting question. So far, I think we haven't run into anything that has made us have to dive into this super deeply. I think, we are having as much clear communication with the parties that we are working with, letting them know how we are doing this and ways that we're trying to make this a really effective and contactless and safe way to receive food still. And all the individuals we've gathered the contacts to are individuals who work or who usually go to the nonprofits that we deliver food to on a weekly basis. So we're trying our best to make this a very seamless and safe process for everyone.
Thank you, Sue Lynn. Tracy, anything you want to add from your experience to that?
Sure. So I'll just walk people through how food kind of makes it from here to a healthcare center. So our food is prepared here. We then individually package every container, and every kind of takeout box is labeled with the contents and allergens, and then those boxes. So this has been one of the challenging things. Those boxes, the individual takeout boxes are then put into a larger cardboard box. So what we learned is, the virus can live longer on, plastics, metals, non-porous materials. So when we get cardboard boxes in that are in great condition, we sanitize these cardboard boxes. We, quarantine them for multiple days, and then those boxes are repurposed to carry the takeout containers, and they never come back here. So they're disposed of at the health center site. So those boxes get loaded with the takeout boxes. These all go into a delivery vehicle. When we started, we were doing all of our own delivery. Certain restaurants now in Boston are doing enough volume that they need help with delivery. So we've enlisted some volunteers, such as our friends down the street that own a floral company. And they do have large vehicles that are very similar to catering vehicles that can be properly washed down, sanitized daily. And so that's really nice. Folks who have, station wagons, SUVs that are helping as well. Those are non-commercial vehicles, but they are, kept clean and specifically for these purposes. They're not, we did consider like, oh, do we want to partner with a company like Lyft, Uber, et cetera? But I think it does just bring in, more variability because you don't know what else is being stored in those vehicles, what they're using it for, et cetera. But everyone that is volunteering to drive with us does have, a vehicle that's been inspected and is following, the protocols that we've set up. So once these boxes are loaded in, then they're taken to the health center. At the health center, we contact the healthcare coordinators who come out with a cart, usually, 2 people coming out with 2 carts the driver unloads onto the cart and, you know, has no contact, no physical contact with these health center coordinators, and the health center coordinators take those carts into the emergency department. So there's no contact, and drivers are absolutely not going into the health centers. And yeah, so that's the kind of contactless model. In terms of payment, you know, we're not dealing directly with health centers for payment. So we're invoicing to our 501c3s, which is World Central Kitchen nationally and Commonwealth Kitchen here locally in Boston.
Jackie,
Thank
can
you both.
I just,
Please, Ben,
I just want to follow up on something that Tracy mentioned as related to her standard operating procedures for packaging. And one of the things, as we look at the biology of the virus and how, as things are evolving, the viability of the virus to remain on surfaces is really a function of a whole bunch of things: temperature, humidity, as well as how much virus is placed there in the first place. And so I think it's really, we don't in the science world have a strict line on, we know that after 3 days on cardboard or 1 day on plastic, that the virus won't be there. And so I think that as she highlighted, that's one approach to managing the risk associated with the virus being on packaging. But I would really highlight hand washing, especially in situations where people are having trouble getting disinfectants, because that has been one of the biggest challenges that I'm hearing throughout the entire supply chain, that we have lots of sanitizer, but not disinfectants that are on EPA's list N in abundance. And I would, in situations where people don't have access to that disinfectant to do what Tracy's suggesting, I would highlight that hand washing after handling those boxes would accomplish the same risk reduction. The virus isn't going to move from boxes on its own. It's only going to move through our hands. So not, you know, I think it's important that we're sharing, you know, lots of opportunities here. Not saying that Tracy's approach is wrong. It's just one way to look at it, and another way to look at it would be hand washing after handling boxes.
That's great, Ben. And let's actually stay with you for just a second. There's questions around how you mentioned that we're still learning, really, about the virus and all the different implications that it's having. Do you see any sort of drastic changes in some of the standard operating procedures and recommendations around food safety coming, or do you think we're on the right track and just need to be adopting them?
I think we're on the right track. I don't see any. I saw a really good quote today that I'll steal from an article in the Atlantic, where there's no real plot twists at the end as we see a lot of the data that's coming out. We know that the virus is not very stable at high temperatures. We don't have a magic temperature though right now that says, similar to what we would see, you know, everybody's familiar with endpoint cooking temperatures for things like poultry at 165 degrees. We don't really have the benefit of a temperature like that right now for SARS-CoV-2, and we may never have a magic temperature if we're looking for eradication of it in a food product. So I think we are definitely on the right track on highlighting cleaning and sanitizing on food contact surfaces and cleaning and disinfectants on non-food contact surfaces, being mindful of hands. And you know, the video that Tracy posted, I think, is a really great example of just understanding the mechanisms that hands are able to move the virus around, and that being something that we're concerned about. I would say that as there are different phases of relaxing social distancing and reopening businesses, my absolute guess is that there are going to be many businesses that in the past have used self-serve models for condiments, for buffets, for other types of items where patrons come in, that I think will go away in the short term. And that might not be a regulatory requirement, but I think that it is something that the science kind of shows that high touch surfaces need to be managed. And so practically, it's easier to eliminate those than it is to clean and disinfect between use, thinking about a buffet service, or and really even down to like condiments on tables, salt and pepper shakers, ketchup bottles, and other items that may have just been there. I think we will see some changes to how those are managed until we have a logistical, practical logistic way to manage them.
Thank you, Ben. A couple of questions here I'm going to open up to the whole group, whoever wants to speak to them, and it's really related to the relationship between food safety and waste. It looks like both food waste and non-food waste, material waste. So there's a question around how we can encourage food safety without creating extra trash, non-food waste specific, but then also if there are any standard operating procedures or tips for food waste collection in kitchens right now with the changes in operation. So let me open that up. Just any comments on the relationship between waste generation and food safety and how we can be avoiding increasing waste.
I can jump in really quick with some of the learnings that we've had over the past 8 weeks on this. Very early on, and really like, thinking about Tracy's timeline, as she said, going back to March 14th or March 15th, as things started to really become more apparent that we were going to be in this for a while, we did hear right around the country and actually internationally about food donations really being impacted by concerns about virus movement on those foods and on those packages. And so much so that a group of food safety scientists and virologists, we put together an open letter to the emergency food world to sort of highlight that we don't have any examples of food or food packaging leading to issues related to illness, and that we should not treat that food any differently than we would beforehand. And because I had not just me, but our community had a lot of concerns about this exact question about increased food waste. And being around this for a while now, my views on that have not changed. I don't think we have any science that changes that. I don't see the threat of COVID-19 illnesses being a realistic reason for us to change what we're doing when it comes to food donations or food waste, I guess by changing what we're doing for donations leading to waste. I think that we have ways to manage the risk of transmission that are not related to waste. So I just wanted to sort of lay that out, that the science right now doesn't say that we should be doing anything differently from a food safety standpoint that could lead to waste issues.
Thank you, Ben. Any of the other panelists want to speak to that?
I would just say include some type of plan in what you're doing to account for food waste. For example, we had someone reach out to Replate really last minute yesterday who is also producing food to bring to hospitals in New York. And they had hundreds of trays of food that ended up being extra food. Because they contacted us and we were able to move quickly, we could find a home for that food. But if you are also operating right now and creating a lot of food right now, whether it's to feed hospital workers or for your own business, just think about contacting and thinking about who your local food rescue organizations are, because there are still people who need food and there are still people who are retrieving that surplus food. So just understanding what's available in your community.
Thank you, Sue-Lynn. Tracy, did you want to add something?
Sure. Yeah, we've been in touch with folks who have kindly donated what otherwise would be excess going to waste. So there's some local folks like Not Just Co donated a bunch of kind of pasta, tomato sauce, and we've been able to use that. And we've also been working with a company, Maple Leaf Farms, that has very nice quality duck in different forms. So there's like raw duck sausage, there's, you know, already cooked sous vide, you know, duck leg, you know, kind of like confit meat. And these items would otherwise be tossed out. So we're lucky to have a team of folks that work specifically on supply chain to get us these donated products. In terms of our own ordering, since we are able to get a schedule ahead of time, we're able to plan our menus pretty efficiently to be as minimal waste as possible. I feel like this is the least amount of waste we've had since we've opened the restaurant. You know, of course, we're operating at much lower volume, and this is not just, you know, food waste, but also materials waste, you know, the amount of recycling, et cetera, you know, composting. But, you know, some of the ways we're able to like use the whole ingredient, you know, we'll get scallion in, and the way that we used to use scallion is that we would slice scallion rings, and it might go on to a garnish, right, for a bunch of different dishes that we have. Right now we're making a roasted scallion and sunflower seed pesto sorts with garlic, olive oil, etc. But we use that entire scallion stock. So we have zero waste from that. And the boxes that they come in are actually like really nice boxes. So, you know, that box goes into quarantine, or we're able to disinfect it and reutilize it to contain the individually packaged goods. Other ways, you know, we'll get certain canned products. So if we get chickpeas, we'll end up using the chickpea liquid for a bunch of different things. We'll use it as like a veggie stock if we make a paella. We'll use it for, what's it called? Dairy-free kind of mashed potatoes that we do. So there's ways to, you know, use the whole product, even though, you know, canned chickpeas might not be on our menu usually, you know, 365 days out of the year. But yeah, we're finding ways to use the whole ingredient, whether, you know, it's a scallion that grew on the ground or chickpeas that came in a can. So
I'll have to try the chickpea liquid. That's a good recommendation. We have time for one, maybe two more questions. For this one, Kevin, let's start with you, and then Ben, you may be able to jump on here as well. But there are a couple questions around labeling, and just if there's any resources you can share or information about having to transition from kind of restaurant and food service labeling now to consumer labeling.
Well, there, in terms of addressing surpluses that are found as a result of food service and institutional food service having such a lower demand, FDA issued some information. We issued a guidance that explained that we would exercise flexibility in terms of the expectations of labeling of specific product that was originally intended for the food service community and now would be instead diverted direct to sale to consumer, essentially saying that you don't need the nutritional facts panels to appear on those products, that either whether you're a manufacturer or you're a restaurateur or a food service operator who is redirecting their product to the retail store, the retail markets. That's one example of where flexibility can be. We're exploring ways we loosened kind of expectations of the way eggs are labeled, because certain eggs are destined for a processing environment versus whole shell sales. So there's some flexibility there. I encourage you to go to the FDA's website to see those particular flexibilities. So those are just some specific examples. I think in general, there's a recognition of because everyone is coming to recognize, as thanks to organizations like REFED who have been pushing the fact that everyone should be valuing the food we have and not wasting any if we can avoid it, to not allow this product that is finding surplus in one place to go to waste. Any flexibility we can attempt to find without compromising safety or nutrition, we want to do that. So.
Yeah, and Jackie, I'll weigh in a little bit just to build on what Kevin said. Two things I think to keep in mind on this, and I've seen really creative ways of diverting food through retail and restaurants that might not have been there before in the area of like meal kits. And I think that as a food safety person, two things come to mind to make sure that people do keep in mind. One is just on allergen and making sure that any sort of sauces that go into meal kits, that there is some sort of labeling related to that, because people who are trying to avoid specific allergens do need that information. And then secondly, looking at different packaging options. One example that I saw last week was a meal kit that was being produced out of a restaurant here in North Carolina that included vacuum sealing of both cooked and raw foods with no temperature control through delivery that could lead to botulism issues and as well as storage. And so if it's one of these situations where it's a labeling issue, but it's also just checking with the local health department about their suggestions on how to do this in the best way to make sure that individuals in their home know how to handle that product, because it can't just be left at room temperature to thaw, or even in refrigerators that are above like 45 degrees Fahrenheit, where there are many refrigerators in the US that are. So like just keeping that type of stuff in mind as we're looking at new things. And just as Kevin mentioned earlier, being really good partners with local health departments on this, and keeping in mind that they're very stretched currently, but that they are there as a resource to help move these types of things forward.
Thank you both. Well, we are getting close to time, so I'm going to go ahead and wrap up the Q&A, and just thank you to all of our panelists. And sorry we're not able to get to all the questions. We get a lot during these, but we'd love to continue to gather questions and best practices from the group. So Lily is going to be sharing, or actually did just share, a link through the chat for a survey. That survey is one to get your feedback on these sessions, but also an opportunity for you to share questions and best practices that we didn't get to today. And we'll do our best at curating and pulling those together, as well as sharing any topics of interest for future discussion. So please do take a look at that survey quickly if you have the time. We will provide a written recap and a recording of this on our website, in the next couple of days. And then next week, we are getting back together on Wednesday, same time, same channel, so to speak, for a session on government and getting government support during COVID-19. So we look forward to seeing all of you back then. And if you have any questions or feedback, please don't hesitate to reach out to us. Thank you again to our panelists. We appreciate your time and expertise, and wishing everybody